Hello, everyone. My name is Doug Elliott, and I'm a senior associate here at Cannon Associates in Edmond, Oklahoma. We do a lot of nursing home negligence here, and I want to talk to you about some of the common scenarios that occur in a nursing home and how the nursing homes try to avoid liability. Normally, what happens in a nursing home when you have to put your loved one there, they've either suffered a fall or an injury or dementia, which lands them in the nursing home. When that happens, the nursing home, you're going into an understaffed situation in most situations. In this normal scenario, your loved one either falls, has a broken hip, or suffers some sort of injury which winds them in the hospital, such as a cerebrovascular accident or a stroke. As soon as that hospital takes care of that individual, your loved one, they're then sent to a long-term acute care center or a special needs facility, which is in a nursing home. But at a special needs facility or at a long-term acute care center, more injuries will occur. And that's almost due to understaffing or undertrained employees who aren't taking care of your loved one. And that is primarily due to neglect on the part of the nursing home. The common theme from the nursing home will be to tell you that your loved one is in their last days and that they are dying and that hospice should be brought in. The thing that you need to ask yourself is, on the date of admission, were they in their last days? And if the nursing home sped your loved one along the way to their last days. A common defense on the part of the nursing home will be that your loved one had a disease or a condition that prompted or caused their injury. In a technical term, these are called comorbidities. And those comorbidities are normally diabetes, peripheral artery disease, obesity, and dementia. Your loved one is placed in a nursing home at a very precarious time in their life without the ability to get out of their own bed, to reposition their weight, or even take a drink of water due to dementia that is usually a result of a stroke. Undertrained and understaffed personnel tend not to help your loved one with these basic life items. I have seen these injuries cause bed sores that expose the spine or other bones on your loved one, called a bed sore. And these bed sores can lead to injury or death. The majority of these bed sores are caused by either dehydration or understaffing, not repositioning your loved one. I was a director for a home and ran 7 homes in the state of Oklahoma, and I saw this condition come up more than once. Minor bed sores are going to occur. It is just part of the aging process and laying in a bed for numerous hours. But bed sores that reveal the spine or other bones should never happen. It is a very stressful time for you to have to place your loved one in one of these nursing homes. But to find out that the basic needs of your loved one are not being met by undertrained and understaffed personnel, due primarily to the greed of the corporate giant that is running that nursing home, should never happen. My name is Doug Elliott, and I want to help you to overcome the greed of that corporation and make sure your loved one's needs are met. We here at Cannon Associates understand it's a very stressful time when you have to place a loved one in a nursing home. But what's even more stressful to know is that the greed and avarice of corporations are not providing trained staff personnel to take care of your loved one. We want to break down that greed and get your loved one the help they need. Give us a call at Cannon Associates.